Hello doctors, today we will learn about the knee joint. Here are the important side headings are there like features, articular surfaces, then ligaments, bursae, arterial supply, nerve supply, then the movements of the knee joint, unlocking and locking and everything. And let's discuss about that each and every point step by step. First are the features of the knee joint. It is the largest and most complex joint of the body. This complexity is due to fusion of three joints. Why it is the most complex joint? Because it is the fusion of the three joints in one. Which three joints? These are the lateral femorotibial and medial femorotibial and femoropatellar joints. These are the three joints form one joint, hence it is the complex joint. Let's see the type of the knee joint. It is the condylar synovial joint incorporating two condylar joints between condyles of the femur and tibia and one saddle joint between femur and patella. Here are the three joints. Two are the two condylar joints, these two condylar joints, and one is between femur and patella, that is the one saddle joint. Let's see the articular surfaces. The three articular surfaces, condyles of femur, patella and condyles of tibia. Here is the one note point that the femoral condyles articulates with the tibial condyles below and behind and patella in the front. You can imagine the knee in your mind that femur attaches to tibia, lateral and medial, and in front patella is attached to femur. Then we will discuss about the ligaments. Figures we can understand at the last. First we can understand the theory about each and every point. First one is the fibrous capsule. It is a very thin, deficient anteriorly and replaced by quadriceps femoris, patella and ligamentum patelli. Third point is the femoral attachment of the fibrous capsule. Anteriorly it is deficient, posteriorly attached to intercondylar line and laterally encloses origin of the popliteus muscle. It is the femoral attachment of the fibrous capsule. Then tibial attachment of the fibrous capsule anteriorly descends along margin of condyles to the tibial tuberosity where it is deficient. It is the anteriorly deficient ligament, and posteriorly it attached to intercondylar ridge, and posterolaterally there is the gap behind lateral condyle for passage of tendon of the popliteus muscle. Let's see the last point for this ligament. Capsular ligament is a weak and it is strengthened anteriorly by the medial and lateral patellar reticuli. It is anteriorly deficient, so it should be strengthened. How? It is strengthened by anteriorly, laterally, medially and posteriorly by these medial and lateral patellar reticuli, laterally by iliotibial tract and by medially by expansions from the tendon of sartorius and semimembranosus, and posteriorly by the oblique popliteal muscle. And sixth are the openings of the fibrous capsule, that two constant gaps, one leading to suprapatellar bursa and second for exit of tendon of popliteus muscle. Second ligament is ligamentum patelli. Central portion of the common tendon of insertion of quadratus femoris, and its length is 2.5 cm and breadth is 2.5 cm, means 3 inch 1 inch, and then attached above to margins of the rough and posterior surface of apex of patella. It is attached to femur. Patella is attached to femur by this ligament. attached below to smooth and upper part of the tibial tuberosity, related to superficial and deep infrapatellar bursa and infrapatellar pad of the fat. Third ligament is tibial collateral or medial ligament. Long band of the great strength, and superiorly it is attached to medial epicondyle of the femur just below the adductor tubercle. It is the tibial collateral ligament and it is also called as the medial ligament. Inferiorly it divides into these two parts, that anterior superficial part and the posterior or deep part. Anteriorly it is 10 cm and 1 cm broad. In posteriorly it's short and its anterior part is attached below to the medial border and posterior part of the medial surface of the shaft of the tibia, and posterior part blends with capsule and with the medial meniscus. Medial meniscus is the another ligament we will see further, and separate anterior part separated from the capsule by one or two bursa, and posterior part attached to medial condyle of the tibia above the groove for semimembranosus. Fourth point, it is morphologically tibial collateral ligament represents degenerated tendon of adductor magnus muscle. It is star point that its tibial collateral ligament is the degenerated tendon of the adductor magnus muscle. It can be MCQ also. Fourth ligament is fibular collateral or the lateral ligament. You can remember as tibia in the medial side, so tibial collateral called as medial ligament and fibula is lateral. Then fibular collateral ligament is also called as the lateral ligament. It is the strong and cord-like 5 cm long and superiorly attached to lateral epicondyle of the femur and inferiorly embraced with by tendon of biceps femoris attached to head of the fibula in front of its apex. Hence it is called as a fibular collateral ligament, separated from lateral meniscus by the tendon of popliteus muscle. And morphologically it represents femoral attachment of peroneus longus. It is the inferior lateral genicular vessels and nerves separated from the capsule. If we should separate the genicular vessels and nerves from the capsule, it's because of the fibular collateral ligament. Then the fifth ligament is the oblique popliteal ligament. First is expansion from the tendon of semimembranosus muscle, and it runs upwards and laterally blends with posterior surface of capsule, and it attached to intercondylar line and lateral condylar of femur. Third one is the closely related to popliteal artery and pierced by middle genicular vessels and nerves and terminal part of the posterior division of obturator nerve. It is the star point for the oblique popliteal muscle that closely related to these arteries, nerves and obturator nerve. Next ligament is the important ligament, that arcuate popliteal ligament. It is the Y-shaped fibrous band. Posterior expansion of the short lateral ligament. It is the cord-like thickening of the capsule to the fibular collateral ligament, and it extends backwards from the head of the fibula, arches over the tendon of the popliteus, and attached to posterior border of the intercondylar area of the tibia. Imagine these attachments is shown here, that it extends backwards from the head of the fibula, arches over tendon of the popliteus, and attached to posterior border of the intercondylar area of the tibia. Then seventh ligament is cruciate ligament. It is a very thick and strong fibrous band which supports the knee joint and acts as the direct bonds of the union between tibia and femur to maintain antero-posterior stability of the knee joint. Is the important point that its cruciate ligament maintains the antero-posterior stability of the knee joint because it has the direct bonds of the union between tibia and femur. Next, the named according the attachment of the tibia: anterior cruciate ligament and posterior cruciate ligament. Anterior cruciate ligament begins from anterior part of the intercondylar area of the tibia and runs upwards, backwards and laterally attached to posterior part of the medial surface of the lateral condyle of femur, and it is taught during extension of the knee. And posterior cruciate ligament, it begins from the posterior part of the intercondylar area of the tibia. It runs upwards, forwards and medially, then attached to anterior part of the lateral surface of medial condyle of the femur, and it is taught during the flexion of knee and is supplied by middle genicular vessels and nerves. It is so important ligament. You can see in diagram. Wait for a minute. And next ligament is the menisci or semilunar cartilages. It is the two fibrocartilaginous discs shaped like crescent-like shapes. Deepens the articular surface of condyles of the tibia. Here is the tibia, and inside articular surface these crescent-shaped menisci are present. Partially divides the joint cavity into upper and lower compartments. Fourth one is the flexion and extension of knee take place in the upper compartment, whereas rotation takes place in lower compartment. Each meniscus has following two ends, two borders and two surfaces. Let's see two ends, that the anterior and posterior ends of menisci are attached to tibia and are referred to as anterior and posterior horns. Two borders, that outer border is thick, convex and close to fibrous capsule. Inner border is thin and concave and free. And the two surfaces, that the upper surface is concave for articulation with femur and lower surface is flat. Peripheral part is thick and vascular, and inner part is avascular, nourished by the synovial fluid. It is so important. It is also 6-mark question for short answer questions. Then medial meniscus has more firm attachments to tibia. It is semicircular, wider behind in front, and posterior fibers of the anterior end are continuous with the transverse ligament. And next one is the peripheral margin is adherent to the tibial collateral ligament. Let's discuss about the lateral meniscus. Nearly circular, posterior end is attached to medial condyle of the femur through two meniscofemoral ligaments, and tendon of the popliteus and capsule separates this meniscus from fibular collateral ligaments. Mobility of the posterior end of this meniscus is controlled by popliteus and two meniscofemoral ligaments. In young person, peripheral 25 to 33% of the meniscus is innervated and vascularized. Remaining part receives its nutrition from the synovial fluid. Ligaments also requires the nutrition, and this meniscus innervated and vascularized, and remaining part of this meniscus receives its nutrition from the synovial fluid. Movement is important for cartilage nutrition, since movement causes diffusion of the nutrients from the synovial fluids to the cartilage. It causes the diffusion of the nutrients from the synovial fluids of the cartilage. Next, the functions of the menisci. They help in making articular surfaces move congruent and serves as shock absorbers. Absorbers are present in like cars and bikes. It's also important in our body to bearing weight and absorb the shocks. Help in lubricating joint cavity and therefore and their nerve supply, and they have sensory functions. They give rise to proprioceptive impulses. Next ligament is the transverse ligament. It connects the anterior end of the medial and lateral meniscus. That's it. Then the bursae around the knee. Bursae is only their anterior, lateral and medial bursae are there. It's not that much detail, but only you should remember these names at least. First we will see there are 3 types of bursae are there. Each are 4. First one is anterior, second lateral, and third is medial. Anterior, there are 4 bursas: subcutaneous prepatellar bursa, subcutaneous infrapatellar bursa, deep infrapatellar bursa, and suprapatellar bursa. Anteriorly, you can see there is patella, there is femur, here is tibia. Inside view, patella is present in anterior portion. We can see here is the patella, here is femur and tibia and fibula here. So all the ligament bursae are there that name are related to patella. You can remember as like this. Then lateral, bursa deep to the lateral head of gastrocnemius, bursa between fibular collateral ligament and biceps femoris, and bursa between fibular collateral ligament and tendon of popliteus, and bursa between tendon of popliteus and lateral condylar of the femur. Next, the medial. It also have mnemonics that match medial head of gastrocnemius and anserine bursa, and then tibial collateral ligament bursa deep to the tibial collateral ligament T, and yes, bursa deep to the semimembranosus S. Then we will see the relations of the knee joint. Anteriorly, anterior bursa, ligamentum patelli and patellar plexus of knee is simple. Mnemonic is LAP. Next, the posterior relations at the middle, popliteus vessels, tibial nerve, and posterior laterally, lateral head of gastrocnemius, plantaris and common peroneal nerve. Then the posteriorly, it's related to the medial head of gastrocnemius, semitendinosus, semimembranosus, gracilis and popliteus muscle. Medially, it related to sartorius, gracilis, great saphenous vein and semimembranosus vein. Laterally, it's related to biceps femoris, tendon of origin of the popliteus muscle. Let's see the blood supply of the knee joint that contains 5 points: 5 genicular branches of popliteal artery, descending genicular branch of femoral artery, descending branch of the lateral circumflex femoral artery, 2 recurrent branches of anterior tibial artery, circumflex fibular branch of the posterior tibial artery. These are the 5 arteries and their branches supplied to the knee joint. Then we see the nerve supply. Femoral nerve through its branches and vasta, especially vastus medialis, and sciatic nerve and obturator nerve. This is the diagram for the knee joint from the. Let's see this the trochlear surface of the femur, and these are the fibula and tibia. Medial femorotibial joint is here. Here is lateral femorotibial joint. It is the articular surfaces. It is the patella and it is the patella femoral joint. It is the articular surface of the knee joint. Let's see the ligaments. It is the semimembranosus tendon. It is the oblique popliteal muscle. It is the capsule of the knee joint. This is the capsule. And fibular collateral ligament is present. It is the popliteus tendon, and tibial collateral ligament is here. In this diagram, lateral meniscus of the tendon is here, and fibular collateral ligament. In medial view, you can see this is the tibial collateral ligament. This is the ligamentum patelli. It is the medial meniscus. It is semimembranosus, gracilis, and sartorius tendons. It is the deep diagram for the knee joint with its relations. You can remember, and you can draw. You should draw this 2 to 3 times. Then this is the diagram for posterior cruciate ligament and anterior cruciate ligament. It is the ligaments shown that posterior, that is a lateral menisci, it anterior horn, and it is the posterior menisci. Let's see, this is the showing diagram, the bursa in anterior view. No, it's not anterior view, it is the side view. It is the subcutaneous infrapatellar bursa. It is the patella, it is infrapatellar bursa, prepatellar bursa, and it is the deep infrapatellar bursa and its tibial tuberosity. That's it.